What is PTSD? Post-traumatic stress disorder is a psychological condition that was first defined in 1980 in the Diagnostic and Statistical Manual of Mental Disorders. This definition was based on the evidence that a specific pattern of psychological phenomenology occurs in some individuals who have been exposed to traumatic events. Traumatic events have a different quality than other life stresses, being characterized by people's reactions to fear, horror, and helplessness in a setting of severe threat of death or injury. According to the PTSD Recovery Program Therapist Manual, there are 4 main types of symptoms: re-experiencing, repetitively reliving the trauma. This can be in the form of nightmares, intrusive memories or images, flashbacks, or intense emotional or physical reactions to a reminder of the trauma. These symptoms frequently leave you feeling like you're going crazy. The second one, hyperarousal. This includes sleep problems, anger, irritability, concentration problems, always feeling on the edge or on guard, jumpiness, and being easily startled. Increased arousal could also include physical symptoms such as pounding heartbeat, sweating, dizziness, and rapid breathing. These symptoms keep you stressed and eventually exhausted. The third one is avoidance of trauma reminders. This may include trying not to think or talk about the trauma, or trying not to have feelings about it. It may also include staying away from the activities, people, places, and situations that bring up trauma memories. These symptoms leave you feeling apart from the people that surround you in your life. The fourth and last one is emotional numbing. This includes losing interest in activities that used to be important to you, feeling detached or estranged from important people in your life, feeling unable to have normal emotions, and losing a sense that you have a long-term future. These symptoms diminish your relationships with those closest to you. According to PTSD.gov, National Center for PTSD, medication can help with biological PTSD symptoms. CBT, like prolonged exposure, work better than simply taking medication, although some people may prefer taking medication or may benefit from combining both medication and therapy. According to the National Center for PTSD, the medications that they use are Zoloft and Paxil, which are strongly approved by the FDA. VA, DOD, first line of treatment use Prozac and Effexor. According to Dr. Kenneth Iserson, author of Improvised Medicine, Treating PTSD, 3 good treatments are available for PTSD. The only one that works in situations where mental health resources are scarce is using medication, generally a selective serotonin reuptake inhibitor if available. When mental health resources are available, CBT, eye movement desensitization, and reprocessing have proven beneficial. U.S. National Library of Medicine, National Institutes of Health, Journal, states, the National Center for PTSD also estimates that under normal and usual social-political conditions, 8% of the U.S. population will experience PTSD at some point in their lives, with women 10.4%, twice as likely as men, which is at 5%, to develop PTSD. At the beginning of the millennium, it was estimated that 5 to 6 million U.S. adults suffer from PTSD. Because of the traumatic developments of recent years and ongoing turmoil worldwide, it is possible, that even probable, that the incidence of PTSD will sharply increase within the next decade, and that it may become one among the most significant public health concerns of the new century.